Today is February 2nd, 2022, and we have a snow day today, so no work. So I'm going to take advantage of this time to really work on my shoulder. So I started having frozen shoulder. I don't even know when it started, but I I went to the doctor in the end of September maybe, and I started PT. And then I went back to the doctor and then to the orthopedic surgeon who gave me a cortisone shot and continued PT. The problem is the cortisone shot did not help. It did not work. They said go in for another one just to see if it will help. And I said no. It's painful. I can't, I do not get a good night's sleep. I wake up several times, at least one major time where I actually am wide awake and I'm trying to figure out what to do to go back to sleep, whether that is to take a half Xanax, or get up and use the lacrosse ball on my muscles in my back to try to relax them to go back to sleep. So sometimes I do that, or sometimes I just lay there, or sometimes I just get up, and that's that can be a pretty long day after that, but such as it is. So this is my right arm, and it's actually getting a little sore, and I'm kind of worried about that. I can get all the way up my back there. I am a little worried because I'm starting to get some pains in certain places in my deltoid, and just some weird pains. But I'm hoping that is overuse and that I'm not going to get the frozen shoulder in this side. This is my range of motion on this side. So so it's different because you can see what my shoulder does. I can, I'm moving my body to get my arm up further. But if I were to just stay, just stay normal here, and that is the furthest that I can get. It's the range of motion is not good. So I can't, I can't put my hair up. Now I did manage very painfully to do this, and I can only get it toward the front of my head like this, and which is fine, and I can do a somewhat bun in the back, but it's pretty painful to do. But I did this. I was upside down and did this. So this is where I'm at here. So I can go all the way up with this arm, but that's the furthest I can go there. So front wise, it takes a lot of energy to do, and that's as far as I can get. And then I cannot, so that's painful. But I can do this with that arm, but this is as far as I can get with this one. And I definitely can't go behind my back like that or up my back to do my bra or anything like that. I mean, the furthest I can get going toward the back is right here. I can't reach them. I would not be able to reach in my back pocket. And my hand kind of does this thing. So like here, I'm putting my hand on my hip. This is what I can do here. I cannot go. It is very painful. So this is, I'm going to try something new. I'm starting a program called Got Ram, and it's a shoulder program. So I'm just going to try it. At this point, I've been using the lacrosse balls on trigger points, and I've been doing a lot of meditation and journaling to help with just emotional, maybe thinking that maybe my body is reacting reacting to stress or emotions or something like that. So I've been getting back into that. I have been on the treadmill because I have, I've always been active, but I've been definitely been more diligent since being diagnosed with the genetic heart condition. So I'm very diligent with my treadmill work, and I could be eating better. That's for sure. Maybe that will be a step in this program, is maybe cutting out sugar or something like that. I don't eat a lot of sugar as it is, and I used to do keto, which didn't serve my body well, so I stopped. But I may be needing to do a kind of a mix of way of eating to deal with inflammation and such. So at any rate, this video is more so for my own progress evaluation, to look back on and just see what worked, what didn't work. I did buy a TENS unit with the electrical, and I'm going to just see. I know that's only temporary, but if something can soothe, it really helps with it really helps psychologically. So the TENS unit, the lacrosse ball on trigger points. I was using the pulley system, but I'm going to stop doing that for now and just focus on the exercises that this program teaches. And we'll see if this helps or not. I'm just not willing to go to PT, and especially since the deductible has started over, spend whatever it is, the full amount. It can be anywhere from $100 to over $300 a session, and they want me to go 2 to 3 times a week. And so you got to pay full price until your deductible's met, and I'm not willing to do that, especially when it feels like it's harming more and not doing, it's not healing it. So that just seems ridiculous to me, to keep go there and be tortured, them manipulating my arm way past the point of pain, and to not get anywhere with that, and then just to be in more horrendous pain than I am. I mean, some days are better than others, but this is probably one of the most painful conditions, because it's constant. It's, and it gets these zingers, these acute, like, painful, just jolts of pain that travels down, and then I'm just slumped over for seconds to a couple minutes sometimes. Sometimes it's brought me to the floor with the pain, and it's nauseating, and my arm just gets heavy, and it's almost paralyzed for a bit. And then I've learned to try to guard it if I'm going to be in a situation, but sometimes it's just unexpected. I was on the treadmill this morning, and it just moved in a slightly weird way, and it just did that zinger, and it's not fun. I hate to complain about it, and people just, you can't understand unless you've had it or have it, because it's just the weirdest thing. Like they say, it lasts 1 to 3 years. I can't do that. So I'm going to try to I'm not going to push myself. I'm not going to try to make something happen. I'm going to try to be patient, which is not one of my virtues, but I'm getting better at it. Meditation is helping me with that. So I'm just going to keep pressing on and doing this program, and maybe doing more yoga. Definitely going to continue my meditation practice, because that certainly helps. And just keep pressing on, man. So yeah. So I'm up on 10 minutes for this video, and I hope it will be helpful for myself later on.